All right, now crippling pain, ongoing medical procedures, emotional turmoil, that is what thousands of Aussies are dealing with when they show up to work each day. Now there's a push for employers to give their staff leave to deal with reproductive health issues, and research says it could actually save a fortune in the long run.
Samantha Patain's journey to motherhood wasn't an easy one.
I was 28 years old when I was told to go see a fertility specialist. It was just really difficult, to be very honest. Every second day, I would have to quickly drive there at 7 a.m, get the bloods done, and off I go to work pretending like nothing ever happened.
A process made harder because, like most Aussie employers, her workplace at the time didn't provide access to reproductive leave.
I had 8 IVF cycles. There were times where I had to potentially take unpaid leave because I had consumed all my sick leave.
Samantha found a new job, one that did offer paid leave for IVF treatments, a move she says made all the difference.
It was a game changer because I received the leave that I needed to be able to get the treatments I needed, and I managed to fall pregnant.
Reproductive leave is paid time off for workers to manage conditions or undertake procedures related to their reproductive health.
It would cover people going through fertility processes, people who suffer from conditions like endometriosis, anything to do with their reproductive health.
It also covers things like menopause, miscarriage and vasectomies, but currently only a handful of Aussie businesses and some state governments offer it.
We've actually heard from workers going to work with a bucket next to them in case they vomit. We've had people who've had to take unpaid time off because they can't physically stand up.
Business groups maintain it's not a feasible policy for every employer.
This sort of additional benefit really is something that a lot of those businesses simply can't afford.
But now, new union-commissioned research has revealed reproductive leave would actually save businesses and our economy money in the long run. Findings show it would cost $920 million each year to give all Aussie workers 12 days of reproductive leave. But not providing it ends up costing the economy more than $26 billion annually. That's almost 30 times more expensive.
At the moment, we're actually seeing productivity losses, things like exiting the workplace early due to menopausal symptoms, people not getting promoted because of the amount of time they take off work, people that could work full-time but for their reproductive health and have to work part-time.
So could reproductive leave prove a win-win for organisations and their employees?
I feel like I owe it to my organisation, all the work that I could possibly give and all the effort I can give, because they supported me through the most important moment of my life.
Oh, I wish that there was a world that I could see this working. I can't quite just yet. And I'm not sure if that's necessarily a good or bad thing. I have people in my life who would so benefit from this because their body attacks them when it's that time of the month, and they could just really have this in their back pocket because they really truly need it. But I'm not sure quite practically how it necessarily fits in with our current work model.
Yeah, and if you're a small business, you just simply can't afford it. I mean, look at the leave that we have. We have annual leave, sick leave, compassionate leave, carers leave, domestic violence leave. It's really hard to keep a business afloat when that much leave is on the table. Yeah. I don't know, I kind of look at, though, the birth rates, the falling birth rates in Australia. And when I look at, if it can help with fertility, perhaps, it might be a good idea.
And questions around this always come into what's deemed fair, right? Yeah. So I think in regards to this leave being proposed, it would be that both men and women would get 12 days leave to use how they would, because reproductive health can mean a number of things for men as well as women. And I think...
But fewer things.
Fewer things.
I think that's the sticking point, right?
Yeah. But I don't think that's necessarily a bad thing. In my mind, that is necessary in order for, if women truly do need this, and so many do, you have to kind of have it be that the semblance of equality.
Well, you don't want that
really
leave working against women, right?
Yes,
you don't want an employer looking at a man and a woman who are both equally qualified going, well, she deserves more leave. Yeah.